Erin. I'm a nursing student here at Chamberlain, and I'm here today to do a head-to-toe assessment. It usually takes about 20 to 30 minutes. Is now a good time for you?
Yes.
Okay, great. So I'm going to provide some privacy, do some hand hygiene. Can you please give me your first and last name?
Alexander and PJW.
Okay, and your date of birth?
9088.
Okay, and are you allergic to anything?
Yes.
What are you allergic to?
Eyes.
What happens when you come in contact with eyes?
I cough.
Okay, so you cough. Okay, so we've noted that. And are you in any pain today?
No.
Okay, so no pain, 0 out of 10?
No.
Okay, so if he was in pain, I would just check where the pain is, how severe it is on a scale of 0 to 10, what aggravates it, what relieves it, when did it start, and if it travels anywhere else. Okay, so moving right along, can you tell me, just a few more questions for you, okay? Can you tell me where we are?
At home.
Can you tell me why you're here?
Because it's Easter.
And can you tell me approximately what time it is?
9:30.
Okay, so he's allergic to person, place, time, and situation. Okay, and while he was talking, I was looking at his facial expressions. They're even and symmetrical. His mood and affect is pleasant. His speech is clear and consistent. His dress is appropriate for a 4-year-old, and his hygiene is good. I don't see any visible devices, and most importantly, I do not see any signs of acute distress. So we're going to move into the assessment. I am going to, another thing I could say, his appearance is consistent with his chronological age. Moving into the assessment, I can put gloves on. I'm going to start with the head, and I'm going to be touching your head. Let me know if there's any pain or tenderness, okay? So I'm just looking for any lesions or infestations, just checking the whole scalp, checking. I don't see any. And now I'm going to move into the face. So I'm looking here at the facial structures. I'm checking the symmetry of those. They're symmetrical. Everything looks midline, and his facial expressions were even. Baby, stop making that noise. Okay. And now I'm just looking at the eyes. I don't see any redness or discharge. The sclera is white. Can you do this for me? Pull down, like this. Oh wow, those conjunctiva are pink. Okay, so we checked that. I don't see, again, no redness, discharge. We got white sclera, pink conjunctiva. Now I'm gonna check the pupils. I can look at the eyebrows, the eyelashes for hair distribution. The pupils are about a 5. Without the light, so they're equal and round. And now I'm gonna do the light. I'm not gonna actually shine the light, okay? So we're gonna do, well, let's just do it. Okay, it's gonna come at you one more time, okay? Open up. Okay, so we've done that eye. Oh, turn on here. So we're looking to see if the pupils accommodate or constrict with the light. So they were reactive to light directly and consensually. I'm gonna do it on this side 2 more times. Pupils were equal, round, reactive to light. They went down to about a 3 with the light. And now I'm just gonna have you look at this and follow it into your nose. And what we're checking there is the ability to accommodate. So pupils equal, round, reactive to light, and able to accommodate. Okay, so now we're gonna move down to the nose. So we're looking at the nose. It is midline, it's even, it's symmetrical. I don't see any deformities on the outside of the nose. So we're looking for deformities, symmetry, and any inflammation or irritation. So we don't see any of that out here. Let's go ahead and check inside. No deformities, no redness, no discharge, no everything, no defects, nothing there. I'm gonna have you go like this. Switch it. Okay, so we've checked his bilateral patency, and now I'm gonna move on to the ears, okay? Are you ready to do the whisper test?
No.
Okay, great. Well, let's do it anyway. So I'm gonna pull up and back. He is over 3 years old. Let me know if do you have any.
No, I'm not.
You're over.
4.
Yeah, that's older than 3. So do you have any pain or tenderness?
No.
Okay. So I'm looking here. I don't see any discharge in the ear. I don't see any redness, irritation, no piercings. We'll do it on this side, baby. And then I'm gonna do it over here. I don't feel any lumps, any masses, any inflammation. Okay, let me look in there, baby. I'll warm my hand up for you. Here, just pull up and back, look in there. I don't see any redness or discharge. I'm gonna do your whisper test, okay? So push back the tragus on this ear. Push it in. I'm gonna whisper 3 words to you, okay? What'd you hear?
I didn't hear anything.
Okay, try again.
Adrian Strong.
Okay, do it on the other side. Flip flop.
Adrian Kahn.
Okay, so you passed the whisper test 6 out
You
of
said
6.
3, but I didn't hear 3.
You heard 3 and 3 on each side, so that tested for cranial nerve 8. So we've tested that. Now we're gonna come in. Hey, baby, stick with me. We're gonna check the mouth. Can I see this mouth? Oh, sorry, Bubba.
That popped my arm.
Oh, I'm so sorry. Okay, so I'm looking at the lips here. They're pink, they're moist, there's no cracks, everything's good. I'm looking in at the oral mucosa, the gums, the tongue, everything's pink and moist. Can you stick out your tongue for me? Can you go? Move it this way. Move it that way. Okay. Can you say light, tight, dynamite?
Light, tight, dynamite.
Okay, so we've assessed cranial nerve 12. Moving the tongue and saying those words, hey baby, is how you assess cranial nerve 12. Then we're gonna have you, can you stick your tongue out? Stick it all the way out, say ah. The uvula was midline and it rose, so now we've tested cranial nerve 9 and 10. Okay? So now I've got a few more things for you. Can you smile big? Can you make a frown? Can you puff out your cheeks? We've assessed cranial nerve 7. Can you say BMW?
BMW.
We've assessed cranial nerve 7 again. So now I'm going to put my hands here. Can you chew? We've assessed the motor function of cranial nerve 5. And now I'm going to have you close your eyes. And every time you feel me touch you, I want you to say, now.
Now. Now. Now.
So pretend that was the soft, and then you do it with the sharp again. Close your eyes.
Now. Now. Now.
So you've assessed the sensory function of cranial nerve 5. Now we're moving down. Can you just swallow for me? So swallowing is part of cranial nerve 9 and 10 again. And then I'm just making sure the trachea is midline. Okay, now I'm gonna have you sit straight up. Sit straight up. I wanna see if you can, look, there's Spider-Man. Look, there's Superman. Okay, so he can look both ways. He can rotate his head bilaterally. Look up, there's the sky. Look down, there's the ground. Okay, and can you shrug your shoulders because you don't know? Okay, try again. Look, there's Superman. Okay, look, there's Spider-Man. Okay, so he was able to move every way. That's cranial nerve 11. While I'm here, I'm just gonna go ahead and palpate the shoulders. That'll be, can you stop making that noise, baby? That'll be the major joint on the top. I feel a normal shape and contour. Can you just go like this? Can you make circles with your arms for me? No, like this. Sit up. Make circles with your arms. No, like this, baby. Okay, well, anyways, he would do circumduction of the shoulders. Can you lift your arms up? Okay, okay. Well, you would test all the range of motion for that. That would be our major joint on the top. Okay, so now I'm just looking at the skin. Since I'm already here, I'm gonna keep going with the arms. So I'm looking at the skin to make sure it's warm, dry, and intact. I'm looking at hair distribution. I don't see any edema. I can go ahead and palpate the radial pulses while I'm here. They're 2+, even in rate and rhythm, equal bilaterally. Gonna go ahead and look at the hands, check the capillary refill. I don't see any signs of clubbing. Can you put this here? You can check for clubbing like this as well. No signs of clubbing there. Looking at the shape and contour of the nails. Don't see any abnormalities there. So I think we're good there. Can you squeeze my hands? Test the strength. They seem like a 5. The shoulders were a 5. Can you just do your wrist like this? Can you put them here? Can you put them here? Just flip flop them. Okay, so check for the range of motion of the wrist. Push against me. Okay, pull against me. I don't know. It's not with him. You could check the inversion and the eversion of the shoulders when you do that. So you would just have them touch. So that'd be inversion and eversion of the shoulders, but you gotta check the major and minor joint range of motion, okay? So now I'm going to do something that I forgot, which is palpate the carotid artery. You can't do both sides at once. Okay, so it's there, it's a 2+, it's strong, okay? So now I'm gonna listen to your lungs, okay? Do you have good lungs? Oh, no? Okay. So I start on the back because there's so much to listen to on the front. So we can just start right on the back. and you can't hear the middle and the back. You just have to hit each lobe 3 times. So whatever, you can just start upper, 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 upper. You can go lower, 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 lower. So once you've done that, you gotta listen to a full inspiration and expiration on each spot. Okay? Now we're gonna do the front. So with the front of the lungs, can you sit up at the front, baby? You're the best patient. Okay. So with the lungs, you're gonna be able to hit the right middle. No, you can't leave. That'll be rude. Okay. So you're gonna start here, and you're at the right upper, or wherever you start, but you're right upper, left upper. Then you're at the left upper, right upper. And once you're in the middle, you're at the right middle, left upper, left lower, right lower, right lower, left lower. And when you come in here, it's left lower over here, but it's right middle when you do it on this side, okay? Then we're gonna come into the heart sounds. That's another time you could assess the carotid artery, but I already did it earlier. So you're gonna be at the second intercostal space of the right sternal border. So I'm gonna go ahead and palpate for that. And you're gonna start with the diaphragm. So we're in the second intercostal space, right sternal border, we're at the aortic valve. Flip to the left sternal border, second intercostal, that's the pulmonic. Third intercostal space, left sternal border, that's the pulmonic. Wait, no, pulmonic was the second. Erb's point is the third second intercostal space is the pulmonic. Third intercostal space is Erb's point. Fourth intercostal space is the tricuspid. And then when you go to the fifth intercostal space, you go mid-clavicular, and that's the mitral valve. And once you're there, you can flip it over to the bell, and you're going to listen all the way back up and through. So fifth intercostal space, mid-clavicular at the mitral. Fourth intercostal space, left sternal border, that's the tricuspid. Third is Erb's point. Second is pulmonic. Second intercostal right sternal border is the aortic, okay? And you've done the diaphragm and the bell, so you're able to move on. And then when you're there, you're able to move on to the abdomen. So you're gonna have them lay down, put the foot thing up so their feet are supported. And the first thing you're gonna do, just regular, is expose the abdomen, and you're gonna look at the color of the skin, see if there's any discoloration, change in pigmentation, and you're gonna look at the contour, okay? What you're looking for with contour, is it scaphoid, which is caved in, flat, rounded, or protuberant? This is pretty flat, I think. Okay, so we've looked at the contour. You can look from here, and you can also walk to the foot of bed and look from there. And the next thing you do is auscultate the abdomen. You don't palpate, so you change the order. Flip that, make sure you're back on the diaphragm. Right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Just listen to a few places in each. Then you're gonna go ahead and palpate. And you're gonna make sure there's no distension or tenderness of the bladder. I don't see any distension. You shouldn't be able to palpate the bladder. So then I'm gonna palpate here. Let me know if there's any pain or tenderness. We're just doing light palpation in each quadrant. And at that point, you're done with the abdomen, okay? We're gonna flip you up and have you do your legs, okay? And one thing I need to still do is sensation of the upper and lower extremities. So I'm gonna have you close your eyes and just say, I'm cool, whenever you feel me touch you, okay? Close your eyes.
I'm cool. I'm cool. I'm cool. I'm cool.
Okay, so you're cool, got it. We checked all the sensory abilities of the upper and lower, sensory perception of the upper and lower. Can you stop, baby? Can you stick with me?
I need something.
Can you just stick with me, please? Okay, so now we're here and we're looking at the shape and contour of the knees. We don't see any abnormal contour. We're looking at hair distribution. Skin is warm, dry, intact. I don't see any edema. I'm looking at the feet, checking the capillary refill down here. I'm gonna go ahead and feel the posterior tibialis, which is here. You can do both sides at once, but it's inside the ankle. Right behind it, then the dorsalis pedis right here. Checking just for strength, regularity, rate, rhythm, 2+. Yours are right there. Okay, and then I'm gonna check the range of motion. So can you pretend you're gonna kick my hands? Like just straighten your legs out. Straighten your legs out. Okay, bend them up towards you. Okay, put him back down. Push against me. Pull against me. Okay, so we've assessed the range of motion. The strength is a 5. Can you spin your ankles around in circles like you're going to spell your name? Your ankles. Those are your wrists. Okay, so what you want them to be able to do is spin their ankles around. Okay, so he can do the dorsiflexion and plantar flexion. Yeah, just push against my hands. Oh, okay, pull against him. Okay, so you can check the strength of that, but you have to do a major and a minor joint. You can either do the ankles or the feet. Now I think we've done everything we're supposed to do.
Name the cranial. 3, 5, 8.
I did, okay. I did all of it.
You did them, but you didn't say it.
Okay, so, well, that ruins the whole thing. Okay, so when I did the 6 cardinal fields of gaze, what I was assessing is cranial nerve 3, 4, and 6. So 3 is up, 4 and 6 are the side and out. This is 5, sensory is 5, 7 is the faces and the BMW, 8 is the whisper test, 9 and 10 are the uvula and rising midline and the ability to swallow, 11 is the moving the shoulders, the spinal accessory, and 12 is the tongue and light tight dynamite. And with that, I'm just gonna have you step up, and can you just walk to me? Regular? Just gonna assess the gait and coordination, so assess all that. And then we're gonna have to put them back in their bed, put it in the lowest lock position, put the side rails up ×3. Your call light here, sir, is within reach. Can you stop doing that? Call light is within reach. Is there anything I can do to make you more comfortable? How would you rate your pain on a scale of 0 to 10?
9.
Okay, thank you so much for your time. I'm gonna do hand hygiene and I'll leave.